Anticoagulant. Definition: anticoagulant is a chemical substance. Anticoagulant. Definition: anticoagulant is a chemical substance which prevents from blood clotting. Mechanism of action of blood clotting. Number 1, प्रोथ्रोम्बिन थ्रोम्बोप्लास्टिन के हेल्प से कैल्शियम की हेल्प से थ्रोम्बिन क्रिएट करते हैं। तो फिब्रिनोजेन जो फैक्टर 1 है वो थ्रोम्बिन और कैल्शियम की हेल्प से फिब्रिन विच इज़ इनसॉल्युबल क्रिएट करता है। उसके बाद फिब्रिन प्लस ब्लड सेल मिलकर एक फाइन थ्रेड्स जिससे ब्लड क्लॉट हो जाता है। आप लोग अच्छी तरह से देख लीजिए मैकेनिज्म ऑफ एक्शन। जो भी हम लोग एंटीकोआगुलेंट यूज़ करते हैं वो क्या करते हैं, ये कैल्शियम के साथ मोस्ट ऑफ द टाइम कैल्शियम के साथ मिलकर वो कैल्शियम चिलेटिंग एजेंट क्रिएट करके ब्लड को क्लॉट होने से बचाता है। और एक ही हेपारिन है जो वो थ्रोम्बिन का एक्शन में इनहिबिट करते हैं, तो इसीलिए ब्लड क्लॉट नहीं होता है। नंबर 1, EDTA डाइपोटेशियम सॉल्ट्स ऑफ इथिलीन डाइअमाइन टेट्रा एसिटिक एसिड, इसका फुल फॉर्म है। इट इज कॉल्ड sequestrin and probably the best anticoagulant for routine hematological investigations. Mechanism of action: it is powerful calcium chelating or binding agent and acts by binding the calcium in blood. So, active calcium ions are not available for coagulation process. Dose 1.5 plus minus 0.25 mg per ml of blood. Uses: number 1, hemoglobin estimation. Number 2, total leukocyte count. Number 3, differential leukocyte count. Number 4, RBC count. Number 5, PCV determination. Number 6, ESR estimation. Number 7, platelet count. Number 8, parasite, that means MP or microfilaria detection. Advantages: number 1, it gives the best preservation of cellular morphology. Good morphology of the cells is observed even after 2 to 3 hours of blood collection. Number 2, EDTA inhibits platelet clumping. Hence, this anticoagulant is preferred for blood platelet counts. Disadvantages: number 1, excess of EDTA, irrespective of which salt, affects both red cells and leukocytes, causing shrinkage and degenerative changes. Number 2, EDTA in excess of 2 mg per ml of blood may result in a significant decrease in PCV by centrifugation and increase in MCHC. Number 3, the platelets are also affected. Excess of EDTA causes them to swell and then degenerate, leading to an artificially high platelet count. Number 2, double oxalate, that is Winthrop's mixture. It is a mixture of two types of oxalates, that means ammonium oxalate and potassium oxalate, in a ratio of 3:2. Dose 2 mg per ml of blood. Mechanism of action: binds calcium and chelates it. Uses: number 1, hemoglobin estimation. Number 2, TLC, total leukocyte count. Number 3, PCV. Number 4, determination of SP gravity, that means specific gravity of whole blood or plasma. Disadvantages: number 1, double oxalate causes alteration of morphology of WBC and RBC. Smear made from anticoagulant added blood is unsuitable for morphological study. It is not much used nowadays. Number 3, trisodium citrate. A 3.8% aqueous solution of trisodium citrate, which formula Na3C6H5O7, 2H2O, is the anticoagulant of choice in studies of ESR and coagulation studies. Mechanism of action: binds calcium and precipitates as double salt, that is calcium sodium salt. Dose number 1 ESR. 4 volumes of venous blood are diluted with 1 volume of 3.8% sodium citrate solution, that is 4:1 ratio. Number 2 coagulation studies. 9 volume of venous blood are diluted with 1 volume of 3.8% sodium citrate solution, that is 9:1 ratio. Uses number 1 ESR. Number 2 coagulation studies. As for example, prothrombin time, activated partial thromboplastin time, thrombin time, D-dimer, etc. Disadvantages. Number 1, this ratio of anticoagulant to blood is critical as osmotic effects. Number 2, changes in calcium ion concentration affect coagulation test results. Number 4, sodium fluoride. Modes of action. Number 1, blocks RBC enzymes, that means phosphorylase, for glycolytic inhibition of glucose. Number 2, also chelate calcium and forms calcium fluoride. Dose 6 mg per ml of blood. Use blood glucose, that means sugar estimation. Number 5, heparin. Mechanism of action. Number 1, heparin powder or liquid acts by inhibiting thromboplastin formation. Number 2, secondly, as an antithrombin, inhibiting the action of thrombin on fibrinogen. Dose 0.1 to 0.2 mg per ml of blood. Uses. Number 1, osmotic fragility test for studies of red cell enzyme, example G6PD and PK deficiency. Number 2, plasma iron estimation. Number 3, demonstration of LE cells. Number 4, lymphocyte culture for karyotyping or genetic studies. Number 5, lymphoma or leukemia panel for flow cytometry or immunophenotyping. Disadvantage. Number 1, it is expensive. Number 2, heparinized blood is unsatisfactory for blood films and counts as it tends to cause leukocytes and platelets to clump. Number 3, it is interfered to EDTA for general use.